What should you do when you have hyperglycemia or high blood sugar? This is part 3 of the insulin titration series. Blood sugar levels have to be maintained within a specific target level recommended to you by your doctor. These are the recommended blood sugar levels for non-pregnant individuals. Pre-meal blood sugar levels should be 80 to 130 milligrams per deciliter. 2 hours post-meal blood sugar level should be less than 180 milligrams per deciliter. Older individuals, those with diseases like cancer, kidney, or heart problems, prone to hypoglycemia or pregnant may have different target levels. Ask your doctor about this. If your blood sugar levels are always above your target despite proper diet and correct medication, you may need to adjust your insulin. These are the steps in adjusting your insulin if you are on glargine, isophane insulin, bedtime isophane insulin, degludec, or detemir. First, check your fasting blood sugar for 3 consecutive days. Second, add the results for days 1, 2, and 3. Third, divide the sum by 3 to get the average. Fourth, after getting the average, look at this reference table to determine the amount of insulin to be added to your previous insulin dose. If the average blood sugar is 70 to 130 milligrams per deciliter, there's no need to change your insulin dose. If the average blood sugar is 131 to 200 milligrams per deciliter, add 2 units to your current insulin dose. If it is more than 200 milligrams per deciliter, add 4 units to your current insulin dose. Fifth, inject your new insulin dose. Continue monitoring your blood sugar and adjust your insulin as necessary until your fasting blood sugar is less than 130 milligrams per deciliter. Here is an example of insulin adjustment in a person using glargine at 10 units subcutaneously once daily. Fasting blood sugar was obtained on days 1 to 3 with the following results. Day 1, 141 milligrams per deciliter. Day 2, 150 milligrams per deciliter. And Day 3, 153 milligrams per deciliter. Adding days 1 to 3, 141 plus 150 plus 153, a sum of 444 was obtained. Dividing 444 by 3 days, or 444 divided by 3, the average would be 148 milligrams per deciliter. Based on the reference table below, the average fasting blood sugar of 148 milligrams per deciliter would be within the 131 to 200 milligrams per deciliter range. Therefore, 2 units should be added to the current insulin dose. The patient was on 10 units of insulin glargine. 10 units plus a 2 units adjustment dose is equal to 12 units. 12 units would be the new insulin dose. Continue monitoring your fasting blood sugar and adjust your insulin dose as necessary. These are the instructions for adjusting twice daily insulins such as biphasic human insulin, biphasic insulin aspart, biphasic insulin lispro, or insulin degludec with aspart. If the average fasting blood sugar in the morning is higher than the target, increase the bedtime insulin dose. If in the evening, the average pre-dinner blood sugar is higher than the target, increase your pre-breakfast insulin the following day. Also, if a person's blood sugars are always high, combined with weakness, dehydration, or increased sleeping time, contact your doctor or go to the hospital. This is a message from the Philippine Society of Endocrinology, Diabetes and Metabolism, PCEDM Diabetes Advocacy and Study Council.